Hello everyone and welcome. In today's 200 CNA practice test questions and answers 2026 practice session, we'll go through 255 updated questions designed to help you prepare for the exam. When each question appears, pause the video first. Choose the answer you believe is correct, then comment your answer below before resuming the video to see the correct answer. Keep track of your score as you move through the questions, and let's get started. Question 1. When a resident wears a restraint, the nursing assistant must make sure of which of the following? Option A. The resident is wearing an incontinent brief. Option B. The resident is checked once every 4 hours. Option C. The restraint is applied following the manufacturer's instructions. Option D. The restraint is applied tightly and placed under the resident's clothing. The correct answer is option C. The restraint is applied following the manufacturer's instructions. Explanation. Restraints must be applied exactly as instructed by the manufacturer and facility policy to ensure safety and prevent injury. Question 2. When giving perineal care to a male resident who is uncircumcised, the nursing assistant should take which action? Option A. Push the foreskin back to clean. Option B. Keep the foreskin in place over the penis. Option C. Wipe from the base of the penis towards the tip. Option D. Just cleanse the tip and directly over the urethra. The correct answer is option A. Push the foreskin back to clean. Explanation. For uncircumcised males, the foreskin must be gently retracted to clean the area underneath where bacteria can collect. Question 3. A resident who is on a toileting schedule asks to go to the bathroom frequently. The nursing assistant should respond by doing what? Option A. Telling the resident that it is not time. Option B. Decreasing the resident's fluid intake. Option C. Asking the resident to follow the schedule. Option D. Taking the resident to the bathroom as needed. The correct answer is option D. Taking the resident to the bathroom as needed. Explanation. Residents' immediate needs take priority over a set schedule to maintain dignity and prevent incontinence. Question 4. Areas of the body where bone lies close to the skin are known as what? Option A. Skin folds. Option B. Pressure ulcers. Option C. Skin breakdown sites. Option D. Pressure points. The correct answer is option D. Pressure points. Explanation. Pressure points are areas where bony prominences are close to the skin, making them susceptible to injury from pressure. Question 5. To prevent skin tears or shearing when moving a resident, the nursing assistant should do what? Option A. Wear gloves to reduce friction against the skin. Option B. Avoid pulling or sliding the resident when moved. Option C. Tell the resident to be careful and follow directions. Option D. Ask the resident to keep arms held over the head. The correct answer is option B. Avoid pulling or sliding the resident when moved. Explanation. Using a draw sheet or friction-reducing device helps lift the resident rather than sliding them, which protects fragile skin. Question 6. If a resident is lying in bed vomiting, why does the nursing assistant need to help the resident turn onto their side quickly? Option A. To get the resident into a more comfortable position. Option B. To get towels placed to protect the bed linen. Option C. To keep the vomit off the resident's face. Option D. To help prevent aspiration. The correct answer is option D. To help prevent aspiration. Explanation. Turning a vomiting resident to their side prevents them from inhaling the vomit into their lungs, which can cause pneumonia or choking. Question 7. A resident calls and whispers that they had an incontinent accident just before the end of your shift. What should you do? Option A. Explain that the next shift will assist them soon. Option B. Remove wet clothing and place them on a dry underpad. Option C. Ask if the resident feels very uncomfortable. Option D. Provide incontinent care to the resident. The correct answer is option D. Provide incontinent care to the resident. Explanation. Care must be provided immediately regardless of the shift schedule to prevent skin breakdown and maintain resident dignity. Question 8. A nursing assistant enters a room just as a resident's wife slaps the resident. What should the assistant do? Option A. Leave the room and close the door to allow privacy. Option B. Consider if this is normal behavior for this couple. Option C. Report the observation to the charge nurse immediately. Option D. tell the wife that she must leave the facility for the day? The correct answer is option C. Report the observation to the charge nurse immediately. Explanation. Any observation of physical abuse must be reported to the supervisor immediately according to legal and ethical requirements. Question 9. When going to take routine vital signs, the nursing assistant discovers that the minister is praying with the resident. What is the best action? Option A. Ask how long the minister plans to visit. Option B. Explain politely that it is time for vital signs. Option C. Check if the resident is praying before interrupting. Option D. Wait to take the vital signs after the minister has left. The correct answer is option D. Wait to take the vital signs after the minister has left. Explanation. Respecting a resident's spiritual time is important. Routine tasks should be delayed unless they are a medical emergency. Question 10. A charge nurse asks a nursing assistant to perform a task that is not part of their scope of practice. What should the assistant do? Option A. Consider if the task can be performed another way. Option B. Provide the care and perform the task as best as possible. Option C. Contact the Ombudsman office about resident rights. Option D. Refuse to perform the task and explain it is not within their role. The correct answer is option D. Refuse to perform the task and explain it is not within their role. Explanation. Nursing assistants must never perform tasks for which they are not trained or legally authorized, as it endangers the resident. Question 11. A resident with dementia says she needs to get home because her daughter's school bus is coming. The daughter is actually 60 years old. What is the best response? Option A. Let's go see if bingo has started yet. Option B. Remember you are in a nursing home, your daughter is grown. Option C. Do you mean your great-granddaughter? Your daughter is 60. Option D. What do you like to do with your daughter when she gets home? The correct answer is option D. What do you like to do with your daughter when she gets home? Explanation. Validation therapy involves acknowledging the resident's feelings and memories rather than arguing with their current reality. Question 12. The nursing home is having a holiday party, but a resident who is Jewish is not interested in going. What should the nursing assistant do? Option A. Remind the resident how much they enjoy parties. Option B. Encourage the resident to go since others are attending. Option C. Respect the resident's decision and ask what they would like to do. Option D. Ask if they participated in any activities for handcuff. The correct answer is option C. Respect the resident's decision and ask what they would like to do. Explanation. Residents have the right to refuse participation in activities, especially those that do not align with their religious beliefs. Question 13. A resident on the floor says they fell and cannot move their arm. What should the nursing assistant do next? Option A. Help the resident to a sitting position on the floor. Option B. Ask the resident to stay still while you call for help. Option C. Ask the resident to describe the pain and the fall. Option D. Support the arm by placing a pillow under the shoulder. The correct answer is option B. Ask the resident to stay still while you call for help. Explanation. If a fall involves a potential fracture or injury, the resident should not be moved until a nurse performs an assessment. Question 14. Where should the nursing assistant place a urinary drainage bag when the resident is in a wheelchair? Option A. On the floor directly next to the wheelchair. Option B. Tucked at the resident's side on the seat of the chair. Option C. Hung from the back of the wheelchair above the bladder. Option D. Attached to the wheelchair frame below the level of the bladder. The correct answer is option D. Attached to the wheelchair frame below the level of the bladder. Explanation. Gravity is needed for urine to flow from the bladder. The bag must always stay below the level of the bladder to prevent backflow. Question 15. A resident who must stay in bed is at risk for developing which condition? Option A. Dementia. Option B. Arthritis. Option C. Foot drop. Option D. Parkinson's disease. The correct answer is option C. Foot drop. Explanation. Foot drop is a weakness of muscles that makes it difficult to lift the front part of the foot, often caused by prolonged bed rest. Question 16. When counting a resident's pulse, the nursing assistant should do which of the following? Option A. Notice if the rhythm of the heartbeat is regular. Option B. Ask if the resident takes any heart medication. Option C. Consider the time of day when the pulse is taken. Option D. Multiply the rate by 4 if counted for 15 seconds. The correct answer is option A. Notice if the rhythm of the heartbeat is regular. Explanation. Observing the rhythm and strength of the pulse provides important information about the resident's cardiovascular status. Question 17. When a resident is unable to stand, how is their height generally obtained? Option A. Having coworkers hold the resident upright for measurement. Option B. Adding the length of legs, chest, and neck to determine height. Option C. Asking the resident and subtracting an inch for age. Option D. Taking the measurement from head to heels while they are flat in bed. The correct answer is option D. Taking the measurement from head to heels while they are flat in bed. Explanation. Measuring a resident while they are supine and in good alignment is the standard for non-ambulatory residents. Question 18. To help soften the beard before shaving with a disposable razor, the nursing assistant should do what? Option A. Massage the beard area of the face gently. Option B. Rub the beard in the direction of the hair growth. Option C. Hold a warm, wet washcloth against the face first. Option D. Lather the face with soap instead of shaving cream. The correct answer is option C. Hold a warm, wet washcloth against the face first. Explanation. Warmth and moisture soften the hair and skin, reducing the risk of nicks and irritation during shaving. Question 19. A nursing assistant enters a room and finds a trash can on fire. What should be the first action? Option A. Use the resident's pitcher of water to put out the fire. Option B. Open the window to allow smoke to escape. Option C. Remove the resident from the room. Option D. Yell fire and state the location. The correct answer is option C. Remove the resident from the room. Explanation. The first step of the rescue, alarm, confined, extinguish acronym is to rescue anyone in immediate danger. Question 20. While bathing a comatose resident, you notice a reddened area on the hip. What is the most likely instruction from the nurse? Option A. Massage the area using lotion. Option B. Apply dry protective dressing over the area. Option C. Keep the resident positioned to avoid pressure on the hip. Option D. Cleanse the hip using extra soap and rinse thoroughly. The correct answer is option C. Keep the resident positioned to avoid pressure on the hip. Explanation. The most important intervention for a suspected pressure injury is to remove all pressure from the affected site. Question 21. Which member of the healthcare team counsels residents and families and arranges for needed services? Option A. Dietitian. Option B. Social worker. Option C. Physical therapist. Option D. Activities director. The correct answer is option B. Social worker. Explanation. Social workers handle the emotional, social, and discharge planning needs of residents. Question 22. When a person is receiving end-of-life care, the resident's care plan is likely to include which of the following? Option A. Ways to best provide for the comfort of the resident. Option B. Exercises to help improve the resident's strength. Option C. Frequent observation to help prevent confusion. Option D. Instructions for providing post-mortem care. The correct answer is option A. Ways to best provide for the comfort of the resident. Explanation. The focus of end-of-life or palliative care is comfort, dignity, and pain management rather than rehabilitation. Question 23. Hot tea splashes on a resident's hand. What should the nursing assistant's first response be? Option A. Quickly move the resident to the nurse's station. Option B. Ask the resident how badly the burned area hurts. Option C. Wet a towel with cool water and place it against the area. Option D. Apply antibiotic ointment and cover with a bandage. The correct answer is option C. Wet a towel with cool water and place it against the area. Explanation. Cooling a burn immediately with cool water helps stop the burning process and reduces tissue damage. Question 24. A nursing assistant is assigned to provide post-mortem care but has never done it before. What is the best response? Option A. Ask another nursing assistant to trade assignments. Option B. Provide the care since the resident cannot be harmed. Option C. Talk to other assistants about how to perform it. Option D. Discuss the lack of experience with the nurse. The correct answer is option D. Discuss the lack of experience with the nurse. Explanation. Professionalism requires admitting when you need training for a procedure to ensure it is done correctly and respectfully. Question 25. Which action is most helpful to decrease a resident's incontinence? Option A. Leaving the bedpan in place for extra time. Option B. Putting an incontinent brief on the resident. Option C. Answering the resident's call light quickly. Option D. Controlling fluid intake throughout the day. The correct answer is option C. Answering the resident's call light quickly. Explanation. Promptly responding to the urge to urinate is the most effective way to help a resident maintain continence. Question 26. The nursing assistant's role in a bowel and bladder retraining program includes what? Option A. Being consistent with carrying out the toileting schedule. Option B. Notifying the family that the resident is on the program. Option C. Determining the type of program best suited for the resident. Option D. Checking the resident every 4 hours for incontinence. The correct answer is option A. Being consistent with carrying out the toileting schedule. Explanation. Consistency is the key to retraining the body. Following the specific time schedule is the assistant's primary duty. Question 27. A resident with advanced directives has a do not resuscitate order. What does this mean? Option A. The resident does not remember current events. Option B. The resident should not be restrained. Option C. The resident does not respond to instructions. Option D. The resident should not be resuscitated if their heart stops. The correct answer is option D. The resident should not be resuscitated if their heart stops. Explanation. A do not resuscitate order indicates that cardiopulmonary resuscitation should not be performed. Question 28. When a resident's husband begins telling the nursing assistant how to care for his wife, what should the assistant do? Option A. Accept that the husband has always been in charge. Option B. Explain that you are certified and able to care for her. Option C. Suggest that the husband participate in the care conference. Option D. Understand that the husband wants staff aware of her needs. The correct answer is option D. Understand that the husband wants staff aware of her needs. Explanation. Acknowledging the family's expertise on the resident's preferences helps build a therapeutic relationship. Question 29. The term vital signs refers to which of the following? Option A. Any important information about a resident's condition. Option B. The color, condition, and appearance of the skin. Option C. Fluid intake and output as well as bowel movements. Option D. Temperature, pulse, and respirations. The correct answer is option D. Temperature, pulse, and respirations. Explanation. Vital signs are the primary objective measurements used to assess a person's basic body functions. Question 30. The nursing assistant can help the resident have regular bowel movements by doing what? Option A. Making sure the resident gets a lot of rest. Option B. Providing a routine time for the resident to toilet. Option C. Giving the resident cereal for breakfast every morning. Option D. Keeping a bedpan within reach while they are in bed. The correct answer is option B. Providing a routine time for the resident to toilet. Explanation. Establishing a predictable routine helps the body's digestive system regulate eliminations. Question 31. A resident keeps coughing after each drink of fluids. What is the appropriate response? Option A. Give the resident more time to swallow. Option B. Keep the amount of fluid small by using a spoon. Option C. Add thickener to the fluid to see if it helps. Option D. Stop the feeding and report to the charge nurse right away. The correct answer is option D. Stop the feeding and report to the charge nurse right away. Explanation. Coughing during intake is a sign of dysphagia and potential aspiration, which must be assessed by a nurse. Question 32. A new resident asks for help to go to the bathroom before their care plan is completed. What should you do? Option A. Ask the resident to use a walker while assisting them. Option B. Get another nursing assistant to help you walk them. Option C. Position a commode chair next to the resident. Option D. Ask the charge nurse for instructions on what help is needed. The correct answer is option D. Ask the charge nurse for instructions on what help is needed. Explanation. Safety is the priority. Until the care plan specifies the transfer status, the nurse must provide guidance. Question 33. What is the main purpose of a restorative care program? Option A. Ensure the resident can return home. Option B. Provide meaningful activities for the resident. Option C. Help the resident improve their level of functioning. Option D. Provide assistance with activities of daily living. The correct answer is option C. Help the resident improve their level of functioning. Explanation. Restorative nursing focuses on helping residents maintain or regain as much independence as possible. Question 34. A resident is nothing by mouth because of nausea. What should the nursing assistant do? Option A. Give the resident fluids in small amounts. Option B. Provide the resident with a small cup of ice chips. Option C. Ask if the resident can handle any fluids with the nausea. Option D. Remove any fluids at the bedside including the water pitcher. The correct answer is option D. Remove any fluids at the bedside including the water pitcher. Explanation. Nothing by mouth means no food or fluids are allowed. Triggers like water pitchers should be removed from sight. Question 35. While performing range of motion exercises, you notice a resident's elbow is stiff and will not bend. What should you do? Option A. Continue exercises but move on to another joint. Option B. Continue since stiff joints are a normal part of aging. Option C. Apply very gentle pressure to try to bend the elbow slightly. Option D. Suggest the resident see a physical therapist for the elbows. The correct answer is option A. Continue exercises but move on to another joint. Explanation. Never force a joint to move past the point of resistance or pain. Skip the joint and report the finding. Question 36. Which of the following best describes the daily routine needs of residents with dementia? Option A. It is important that the resident's day be kept full of activities. Option B. Changing daily routine is often helpful to residents. Option C. Providing opportunities for activity and periods for rest is important. Option D. Following a strict schedule is required to decrease confusion. The correct answer is option C. Providing opportunities for activity and periods for rest is important. Explanation. Balance is key for dementia care. Residents need stimulation but also quiet time to prevent overstimulation. Question 37. A resident with dementia tries to get out of bed without help during the night. What should you do first? Option A. Orient the resident to person, place, and time. Option B. Review how to use the call light with the resident. Option C. Tell the resident to never get out of bed without help. Option D. Try to find out if there is something the resident needs. The correct answer is option D. Try to find out if there is something the resident needs. Explanation. Behavior in dementia patients is often a form of communication. They may need to use the bathroom or be in pain. Question 38. How much assistance does a resident receiving passive range of motion need from the nursing assistant? Option A. Partial assistance with range of motion exercises. Option B. Full assistance with the assistant taking joints through exercises. Option C. Minimal assistance to just remind them when to exercise. Option D. Minimal assistance to provide support while the resident moves. The correct answer is option D. Full assistance with the assistant taking joints through exercises. Explanation. Passive range of motion means the resident cannot move the joints themselves and requires the assistant to do so. Question 39. When a resident is receiving oxygen, the nursing assistant should do which of the following? Option A. Make sure the tubing is free of kinks. Option B. Remove oxygen when the resident is eating. Option C. Place a no visitors sign on the resident's door. Option D. Limit how often mouth care is provided to the resident. The correct answer is option A. Make sure the tubing is free of kinks. Explanation. Oxygen must flow freely to the resident. Kinks in the tubing can prevent the delivery of the required dosage. Question 40. When providing foot care, the nursing assistant observes an open sore on the foot. What should the assistant do? Option A. Pat gently to dry and cover with a dressing. Option B. Stop the foot care immediately and ask what happened. Option C. Report the skin opening to the charge nurse as soon as possible. Option D. Check the resident's sock for any wound drainage. The correct answer is option C. Report the skin opening to the charge nurse as soon as possible. Explanation. Any break in the skin, especially on the feet of elderly or diabetic residents, must be reported to the nurse immediately. Question 41. Which of the following is the best example of using reality orientation for a resident with early dementia? Option A. Your son plans to visit today at 2 o'clock. Option B. You are in the nursing home. I am here to help you. Option C. This is your daughter Anna. Do you remember her? Option D. Look at the time. Lunch is in 30 minutes. Are you hungry? The correct answer is option D. Look at the time. Lunch is in 30 minutes. Are you hungry? Explanation. Using external cues like clocks, calendars, and schedules helps keep a resident oriented to the present moment. Question 42. A resident has returned from the hospital after a hip replacement. What should the nursing assistant expect? Option A. The resident will be dependent and need total care. Option B. The resident will be confined to bed for several weeks. Option C. The resident will go to physical therapy to increase mobility. Option D. The resident will receive range of motion exercises to the hip. The correct answer is option C. The resident will go to physical therapy to increase mobility. Explanation. Post-surgical care for hip replacements focuses on early mobilization and structured rehabilitation. Question 43. When introducing yourself to a resident, what information should you provide? Option A. Your name and your hobbies. Option B. Your name and your title. Option C. The name of the supervisor and the date. Option D. The reason you chose this career. The correct answer is option B. Your name and your title. Explanation. Proper professional protocol requires stating your name and your specific role, such as certified nursing assistant. Question 44. Properly providing privacy for a resident includes which of the following actions? Option A. Pulling the curtain, shutting the door and covering the patient. Option B. Telling other residents to leave the hallway. Option C. Turning off the television and radio. Option D. Asking the resident to close their eyes during care. The correct answer is option A. Pulling the curtain, shutting the door, and covering the patient. Explanation. Maintaining privacy is a legal right and essential for the resident's dignity and comfort. Question 45. Wrap a blood pressure cuff around the arm with the bladder over the artery at what distance above the antecubital space? Option A. 1/2 inch. Option B. 1 inch. Option C. 2 inches. Option D. 3 inches. The correct answer is option B. 1 inch. Explanation. Correct cuff placement is essential for an accurate blood pressure reading. Question 46. When accurately recording blood pressure, the assistant should be within how many millimeters of mercury of the nurse's reading? Option A. 1 millimeter. Option B. 2 millimeters. Option C. 4 millimeters. Option D. 10 millimeters. The correct answer is option C. 4 millimeters. Explanation. Competency standards generally require a reading within 4 millimeters for both systolic and diastolic numbers. Question 47. When taking a tympanic temperature, how should the nursing assistant pull the ear of an adult? Option A. Pull straight down. Option B. Pull gently forward toward the face. Option C. Pull back and up to straighten the ear canal. Option D. Do not touch the ear, just insert the probe. The correct answer is option C. Pull back and up to straighten the ear canal. Explanation. Straightening the ear canal allows the thermometer probe to get an accurate reading from the eardrum. Question 48. Before taking an oral temperature, what must the nursing assistant ask the resident? Option A. If they have slept well today. Option B. If they have eaten, drank, or smoked in the last 15 minutes. Option C. If they have a history of high fever. Option D. If they prefer a digital or glass thermometer. The correct answer is option B. If they have eaten, drank, or smoked in the last 15 minutes. Explanation. Consuming hot or cold items or smoking can temporarily alter the temperature of the mouth. Question 49. When counting a radial pulse for 30 seconds, what do you do to get the beats per minute? Option A. Divide the number by 2. Option B. Keep the number as it is. Option C. Multiply the number by 2. Option D. Add 10 beats to the number. The correct answer is option C. Multiply the number by 2. Explanation. Multiplying a 30-second count by 2 provides the rate for 1 full minute. Question 50. When counting respirations, the nursing assistant should count for how long to be most accurate? Option A. 10 seconds. Option B. 15 seconds. Option C. 30 seconds. Option D. 1 full minute. The correct answer is option D. 1 full minute. Explanation. Counting for a full minute allows the assistant to observe the rate, depth, and rhythm of breathing. Question 51. When washing hands, you should wash with your fingers pointing in which direction? Option A. Pointing upward. Option B. Pointing toward your body. Option C. Pointing downward. Option D. Does not matter. The correct answer is option C. Pointing downward. Explanation. Pointing fingers downward allows water and soap to flow away from the clean areas and into the sink. Question 52. What should you use to turn off the faucets after washing your hands? Option A. Your clean hands. Option B. A clean, dry paper towel. Option C. Your elbow. Option D. The same towel used to dry your hands. The correct answer is option B. A clean, dry paper towel. Explanation. Using a clean paper towel prevents your clean hands from being contaminated by the dirty faucet handles. Question 53. Which of the following is a demonstration of pressure ulcer prevention? Option A. Keeping the head of the bed at 90 degrees. Option B. Using pillows to reduce skin-to-skin contact. Option C. Giving a resident more snacks. Option D. Scrubbing reddened areas vigorously. The correct answer is option B. Using pillows to reduce skin-to-skin contact. Explanation. Pillows can be used to bridge bony prominences and keep skin from rubbing together. Question 54. Where should the nursing assistant attach a Foley catheter drainage bag? Option A. To the side rail of the bed. Option B. To the headboard. Option C. To the bed frame. Option D. To the resident's IV pole. The correct answer is option C. To the bed frame. Explanation. The bag must be attached to a non-moving part of the bed below the level of the bladder. Question 55. Which of these is a safety guideline for a resident using oxygen? Option A. Light candles to create a relaxing environment. Option B. Ensure electrical equipment is in good repair to prevent sparks. Option C. Encourage the resident to remove the mask during meals. Option D. Allow the water in the humidity bottle to run dry. The correct answer is option B. Ensure electrical equipment is in good repair to prevent sparks. Explanation. Oxygen supports combustion. Sparks from faulty electrical equipment can cause a fire or explosion. Question 56. When performing an occupied draw sheet change, what should the assistant do before turning the resident? Option A. Raise the head of the bed to 90 degrees. Option B. Loosen the sheet and roll it toward the resident. Option C. Place and tuck in the clean draw sheet on the working side. Option D. Remove all pillows from the room. The correct answer is option C. Place and tuck in the clean draw sheet on the working side. Explanation. Preparing the clean side of the bed before turning the resident makes the process faster and more comfortable. Question 57. A cold compress should initially be checked after how many minutes? Option A. 1 minute. Option B. 5 minutes. Option C. 10 minutes. Option D. 20 minutes. The correct answer is option B. 5 minutes. Explanation. Frequent skin checks are necessary to ensure the cold is not damaging the tissue. Question 58. If a nursing assistant is asked to calculate intake in milliliters, how many milliliters are in 1 ounce? Option A. 10 milliliters. Option B. 15 milliliters. Option C. 30 milliliters. Option D. 60 milliliters. The correct answer is option C. 30 milliliters. Explanation. 30 milliliters per ounce is the standard conversion factor used in medical documentation. Question 59. When measuring urine output in a graduate container, how should the container be positioned? Option A, held in the air at eye level. Option B, placed on the floor. Option C, placed on a flat, level surface. Option D, tilted slightly to see the numbers. The correct answer is option C, placed on a flat, level surface. Explanation. A level surface is required to get an accurate reading of the fluid volume. Question 60. A nursing assistant identifies a resident as choking because the resident is doing what? Option A, coughing loudly. Option B, grabbing their throat. Option C, talking in a high-pitched voice. Option D, drinking water very quickly. The correct answer is option B, grabbing their throat. Explanation. The universal sign for choking is grabbing the throat with one or both hands. Question 61. When assisting a resident to stand on a scale, what should the assistant do first? Option A, move the weight to 100 pounds. Option B, move the weight to 0. Option C, ask the resident how much they think they weigh. Option D, have the resident take off their shoes. The correct answer is option B, move the weight to 0. Explanation. The scale must be zeroed to ensure the final weight reading is accurate. Question 62. Anti-embolism stockings should be applied when the resident is in what position? Option A, sitting in a wheelchair. Option B, standing up at the bedside. Option C, lying in bed with feet elevated. Option D, walking in the hallway. The correct answer is option C, lying in bed with feet elevated. Explanation. Stockings are easiest to apply and most effective when the resident has been lying down and leg swelling is minimal. Question 63. How many times should each exercise be repeated during passive range of motion? Option A, 1 time. Option B, at least 3 times. Option C, at least 10 times. Option D, until the resident says to stop. The correct answer is option B, at least 3 times. Explanation. Repeating the motion at least 3 times helps maintain joint flexibility. Question 64. What is the correct angle for semi-Fowler's position? Option A, 10 to 20 degrees. Option B, 30 to 45 degrees. Option C, 60 to 90 degrees. Option D, 100 degrees. The correct answer is option B, 30 to 45 degrees. Explanation. Semi-Fowler's is a common position for resting and preventing aspiration. Question 65. When walking with a resident using a gait belt, where should the nursing assistant stand? Option A, in front of the resident. Option B, at the resident's side or slightly behind. Option C, 3 feet away from the resident. Option D, behind the resident with both hands on their shoulders. The correct answer is option B, at the resident's side or slightly behind. Explanation. Standing to the side and slightly behind provides the best support if the resident stumbles. Question 66. When transferring a resident from a bed to a wheelchair, where should the wheelchair be positioned? Option A, at the foot of the bed. Option B, on the resident's weak side. Option C, on the resident's strong side. Option D, 2 feet away from the bed. The correct answer is option C, on the resident's strong side. Explanation. Transferring toward the strong side allows the resident to use their functional limbs for support. Question 67. When feeding a dependent resident, at what angle should the resident be positioned? Option A, flat on their back. Option B, minimum of 30 degrees. Option C, minimum of 60 degrees. Option D, standing up. The correct answer is option C, minimum of 60 degrees. Explanation. An upright position is necessary to prevent choking and aspiration during feeding. Question 68. What should a nursing assistant do to protect dentures from damage during cleaning? Option A, hold them with a pair of pliers. Option B, line the sink with a towel or fill it with water. Option C, clean them over the floor. Option D, only use hot water. The correct answer is option B, line the sink with a towel or fill it with water. Explanation. Patting the sink prevents the dentures from breaking if they are accidentally dropped. Question 69. When log rolling a resident with hip fracture precautions, you should do what? Option A. Use at least 2 people. Option B. Roll the resident onto the injured side. Option C. Heat the head of the bed at 45 degrees. Option D. Twist the resident's spine slightly. The correct answer is option A. Use at least 2 people. Explanation. Log rolling requires multiple staff to keep the resident's head, spine and legs in perfect alignment. Question 70. How often should oral care be performed for an unconscious resident? Option A. Once per shift. Option B. Every 2 hours. Option C. Every 8 hours. Option D. Once a day. The correct answer is option B. Every 2 hours. Explanation. Unconscious residents cannot swallow saliva or take in fluids, leading to rapid mouth dryness and bacterial growth. Question 71. When giving a back rub, the assistant should apply lotion starting where? Option A. From the neck down to the shoulders. Option B. From the buttocks to the back of the neck. Option C. Only on the lower back. Option D. On the arms and legs first. The correct answer is option B. From the buttocks to the back of the neck. Explanation. Stroking upward from the buttocks toward the neck helps promote circulation toward the heart. Question 72. If you notice redness or skin breakdown during a back rub, what should you do? Option A. Rub the reddened area longer to increase blood flow. Option B. Apply more lotion to the area. Option C. Do not rub the reddened area and report it to the nurse. Option D. Cover it with a band-aid. The correct answer is option C. Do not rub the reddened area and report it to the nurse. Explanation. Massaging a reddened area can cause further tissue damage to a suspected pressure injury. Question 73. When providing foot care, how long should the feet be soaked in warm water? Option A. 1 minute. Option B. 5 to 10 minutes. Option C. 30 minutes. Option D. 1 hour. The correct answer is option B. 5 to 10 minutes. Explanation. Soaking for a short period softens the skin and nails without causing excessive pruning or damage. Question 74. When dressing a resident with hemiplegia, which side should be dressed first? Option A. The strong side. Option B. The weak side. Option C. It does not matter. Option D. The side the resident chooses. The correct answer is option B. The weak side. Explanation. Dressing the weak side first allows for easier manipulation of the garment over the restricted limb. Question 75. When shaving a resident with a razor blade, in which direction should you shave? Option A. Against the direction of hair growth. Option B. In the direction the hair is growing. Option C. In a circular motion. Option D. From side to side. The correct answer is option B. In the direction the hair is growing. Explanation. Shaving in the direction of hair growth reduces skin irritation and the risk of ingrown hairs. Question 76. When providing perineal care for a female, in which direction should you wash? Option A. From back to front. Option B. From front to back. Option C. In a circular motion around the vagina. Option D. From the thighs toward the labia. The correct answer is option B. From front to back. Explanation. Washing from front to back prevents fecal matter from entering the vagina or urinary tract. Question 77. When cleaning the anal area during perineal care, you should wash in which direction? Option A. From the rectum toward the vagina. Option B. From the front toward the back. Option C. From side to side. Option D. Only in circular motions. The correct answer is option B. From the front toward the back. Explanation. Cleaning from front to back ensures that bacteria is moved away from the cleaner areas of the body. Question 78. When using a fracture pan, which side should be placed toward the back of the resident? Option A. The deep side. Option B. The flat side. Option C. The side with the handle. Option D. The side with the splash guard. The correct answer is option B. The flat side. Explanation. The flat, thin end of a fracture pen is designed to slide easily under the resident's buttocks. Question 79. After collecting a stool specimen, what should the nursing assistant do with the specimen cup? Option A. Leave it on the resident's bedside table. Option B. Place it in a transport biohazard bag. Option C. Put it in the refrigerator with the resident's food. Option D. Carry it uncovered to the laboratory. The correct answer is option B. Place it in a transport biohazard bag. Explanation. Biohazard bags protect staff from contamination during the transport of specimens. Question 80. When assisting a client in learning to use a walker, it is important to do what? Option A. Stand behind him and use a transfer belt. Option B. Put padding all the way around the top rim. Option C. Let him walk by himself to gain independence. Option D. Let him practice for the first time on the day of discharge. The correct answer is option A. Stand behind him and use a transfer belt. Explanation. A transfer belt allows the assistant to stabilize the resident if they become unsteady while using the walker. Question 81. The term urinary retention refers to which of the following? Option A. A normal output of urine. Option B. An inability to urinate. Option C. Incontinence or leaking of urine. Option D. A very large output of urine. The correct answer is option B. An inability to urinate. Explanation. Urinary retention is the inability to completely empty the bladder, which can be a medical emergency. Question 82. Normal hearing loss in aging is usually related to the ability to hear what? Option A. High-pitched sounds. Option B. Loud sounds. Option C. All sounds equally. Option D. Rapid speech only. The correct answer is option A. High-pitched sounds. Explanation. Presbycusis, or age-related hearing loss, typically affects the ability to hear higher frequencies first. Question 83. What is the best way to safely identify your patient? Option A. Asking for his name. Option B. Calling his name and waiting for a response. Option C. Checking the bed plate. Option D. Checking the name tag or identification band. The correct answer is option D. Checking the name tag or identification band. Explanation. Using a formal identification tag ensures you are providing care to the correct individual. Question 84. Mrs. Jones is on a bowel training program but has not had a bowel movement for 3 days. What should you do? Option A. Report it to the charge nurse. Option B. Give the patient an enema. Option C. Offer her prune juice immediately. Option D. Increase her fluids yourself. The correct answer is option A. Report it to the charge nurse. Explanation. The nursing assistant must report the status to the nurse, who will then decide on the appropriate medical intervention. Question 85. The proper medical abbreviation for before meals is what? Option A. PC. Option B. BID. Option C. AC. Option D. TID. The correct answer is option C. AC. Explanation. The abbreviation AC stands for antecedent, meaning before meals. Question 86. What is the proper medical term for high blood pressure? Option A. Diabetes. Option B. Hypertension. Option C. Hypotension. Option D. Cerebrovascular accident. The correct answer is option B. Hypertension. Explanation. Hypertension is a clinical term for blood pressure that is higher than the normal range. Question 87. A patient who has difficulty chewing or swallowing will need what type of diet? Option A. Clear liquid. Option B. Low residue. Option C. Bland. Option D. Mechanical soft. The correct answer is option D. Mechanical soft. Explanation. Mechanical soft diets involve foods that are chopped, ground, or blended to make them easier to process. Question 88. To help an Alzheimer's resident feel more independent when they cannot find their room, you should do what? Option A. Scold her and tell her to stay in her room. Option B. Ask her roommate to watch her. Option C. Place a familiar object outside her room door. Option D. Write the room number on a piece of paper. The correct answer is option C. place a familiar object outside a room door. Explanation. Visual cues help residents with memory loss navigate their environment more successfully. Question 89. How often should a resident's intake and output records be totaled? Option A, once each shift. Option B, twice a day. Option C, every 4 hours. Option D, every 12 hours. The correct answer is option A, once each shift. Explanation. Totaling records at the end of each shift allows the healthcare team to monitor fluid balance throughout the day. Question 90. Which of the following should you observe and record when admitting a client? Option A, color of the stool and amount of urine voided. Option B, how much the client has eaten and drunk. Option C, bruises, marks, rashes, or broken skin. Option D, insurance information. The correct answer is option C, bruises, marks, rashes, or broken skin. Explanation. Identifying pre-existing skin conditions upon admission is vital for accurate care planning and documentation. Question 91. When responding to a client on the intercom, you should do what? Option A, ask for the client's name. Option B, say, what do you want? Option C, give your name and position and ask how you can help. Option D, say, the nurse will answer your call. The correct answer is option C, give your name and position and ask how you can help. Explanation. Professional communication on the intercom provides reassurance and identifies a responder. Question 92. Which of the following should you do to familiarize a new client with their surroundings? Option A, show the client where the call light is and how to work it. Option B, tell the client not to operate the television. Option C, ask visitors to leave while you finish admitting the client. Option D, raise the side rails and raise the bed to the high position. The correct answer is option A, show the client where the call light is and how to work it. Explanation. Knowing how to use a call light is the most important safety information for a new resident. Question 93. When arranging a resident's room, you should do all of the following except what? Option A, check signal cords. Option B, adjust the back and knee rests as directed. Option C, administer medications. Option D, check the lighting. The correct answer is option C, administer medications. Explanation. Administering medications is not within the scope of practice for a nursing assistant. Question 94. When assisting a client in and out of bed, the nursing assistant should always do what? Option A, employ body mechanic techniques. Option B, get another person to help regardless of the patient's size. Option C, pull the client's feet out first and then lift the back. Option D, put shoes on the client because they may slip. The correct answer is option A, employ body mechanic techniques. Explanation. Using proper body mechanics protects the assistant from back injuries and ensure resident safety. Question 95. How often should a resident be repositioned during an 8-hour shift to prevent pressure ulcers? Option A, every 2 hours. Option B, every 4 hours. Option C, every hour. Option D, once per day. The correct answer is option A, every 2 hours. Explanation. Standard practice is to turn or reposition residents at least every 2 hours to maintain skin integrity. Question 96. Which is the correct procedure for serving a meal to a client who must be fed? Option A, serve the tray with all others and then come back later. Option B, bring the tray to the client last after all others are served. Option C, bring the tray into the room when you are ready to feed them. Option D, have the kitchen hold the tray for 1 hour. The correct answer is option C, bring the tray into the room when you are ready to feed them. Explanation. Food should be served at the proper temperature when the staff member is available to assist immediately. Question 97. The most serious problem that wrinkles in the bedclothes can cause is what? Option A, restlessness. Option B, sleeplessness. Option C, decubitus ulcers. Option D, bleeding and shock. The correct answer is option C, decubitus ulcers. Explanation. Wrinkles create friction and uneven pressure on the skin, which can lead to tissue breakdown. Question 98. When does restorative care begin? Option A, a week after admission. Option B, as soon as possible. Option C, whenever the patient wants. Option D, twice a week. The correct answer is option B, as soon as possible. Explanation. Rehabilitation and restoration of function should start immediately to prevent further decline. Question 99. Before changing the position of a client's bed to Fowler's position, you should do what? Option A, open the window. Option B, explain the procedure to the client. Option C, check with the client's family. Option D, remake the bed. The correct answer is option B, explain the procedure to the client. Explanation. Always inform the resident of what you are doing before moving their body or their equipment. Question 100. If you accidentally touch the inside of the sink while washing your hands, what is the next action? Option A, allow the water to run over the hands for 2 minutes. Option B, dry the hands and turn off the faucet with the paper towel. Option C, repeat the wash from the beginning. Option D, nothing as long as you use soap. The correct answer is option C. Repeat the wash from the beginning. Explanation. Touching the sink contaminates the hands, requiring a complete restart of the hand washing process. Question 101. When going on a job interview, how should you prepare to dress? Option A, wear your best jeans and a t-shirt. Option B, use a lot of perfume. Option C, wear simple, professional clothing like a dress or slacks. Option D, wear a lot of jewelry. The correct answer is option C. Wear simple, professional clothing like a dress or slacks. Explanation. Professional attire demonstrates respect for the position and the facility. Question 102. Before leaving a newly admitted conscious client alone, the first action should be to do what? Option A, ask him if he's hungry. Option B, inspect his skin. Option C, complete the listing of his clothing and valuables. Option D, make sure he knows how to use the call light. The correct answer is option D. Make sure he knows how to use the call light. Explanation. Safety is the priority. The resident must be able to summon help if needed. Question 103. When lifting a heavy object, the correct method would be to bend at which part of the body? Option A, the waist, keeping your legs straight. Option B, the waist, rounding your shoulders. Option C, the knees, keeping your back straight. Option D, the knees and the waist simultaneously. The correct answer is option C. The knees, keeping your back straight. Explanation. Bending at the knees uses the powerful leg muscles and protects the small muscles of the back. Question 104. At what times during the shift should a nursing assistant wash their hands? Option A, before eating. Option B, after using the bathroom. Option C, before and after patient care. Option D, all of these are correct. The correct answer is option D. All of these are correct. Explanation. Frequent hand washing is the single most important way to prevent the spread of infection. Question 105. When assisting a client with eating, one of the first things the nursing assistant should do is what? Option A, cut the food into bite-sized pieces. Option B, wash your hands and the client's hands. Option C, butter the client's bread. Option D, provide the client with privacy. The correct answer is option B. Wash your hands and the client's hands. Explanation. Cleanliness before meals is essential for infection control and resident comfort. Question 106. A patient has a new cast on his right arm. What is the most important thing to observe first? Option A, pulse above the cast. Option B, color and hardness of the cast material. Option C, warmth and color of the fingers. Option D, signs of crumbling at the cast end. The correct answer is option C. Warmth and color of the fingers. Explanation. Cold or blue fingers can indicate that the cast is too tight and is cutting off circulation. Question 107. Encouraging a client to take part in activities of daily living like bathing and combing hair is what? Option A, done only when time permits. Option B, the responsibility of the family. Option C, necessary for rehabilitation. Option D, a violation of client rights. The correct answer is option C. necessary for rehabilitation. Explanation. Promoting independence helps the resident maintain their current level of function and self-esteem. Question 108. In caring for confused elderly men, it is important to remember to do what? Option A. Keep the bed rails up except when you are at the bedside. Option B. Close the door so he does not disturb others. Option C. Keep the room dark and quiet at all times. Option D. Remind him to shower and shave independently. The correct answer is option A. Keep the bed rails up except when you are at the bedside. Explanation. Safety measures like bed rails, when ordered, help prevent falls in residents who are disoriented. Question 109. Before assisting a client into a wheelchair, the first action should be to check what? Option A. If the client is adequately covered. Option B. If the floor is slippery. Option C. If the door to the room is closed. Option D. If the wheels of the chair are locked. The correct answer is option D. If the wheels of the chair are locked. Explanation. Locking the wheels prevents the chair from rolling away while the resident is trying to sit down. Question 110. You are transferring a resident with a weak left side from the bed to a wheelchair. Where should you stand? Option A. On the right side. Option B. In front of the patient. Option C. On the left side. Option D. Behind the patient. The correct answer is option C. On the left side. Explanation. Standing on the weak side allows you to provide the most support if the resident's leg gives way. Question 111. While making rounds at 4 in the morning, you find a patient on the floor. What should you do first? Option A. Call 911. Option B. Perform cardiopulmonary resuscitation. Option C. Call for another nursing assistant. Option D. Assess the patient's vital signs. The correct answer is option D. Assess the patient's vital signs. Explanation. Checking the resident's status allows you to provide accurate information when you call for help. Question 112. When moving a wheelchair onto an elevator, you should stay in what position? Option A. Behind the chair, pulling it toward you. Option B. Behind the chair, pushing it away from you. Option C. In front of the client to observe them. Option D. To the side and hold the door open. The correct answer is option A. Behind the chair, pulling it toward you. Explanation. Backing into an elevator with a wheelchair is safer as it prevents the small front wheels from getting stuck. Question 113. The Foley bag must be kept lower than the client's bladder for what reason? Option A. So urine will not leak out and soil the bed. Option B. So urine will not return to the bladder and cause infection. Option C. So the bag will be hidden and not embarrass the client. Option D. So the client will be more comfortable in bed. The correct answer is option B. So urine will not return to the bladder and cause infection. Explanation. Backflow of urine from the bag into the bladder introduces bacteria and increases the risk of urinary tract infections. Question 114. Mr. Jones is a diabetic and the kitchen has sent chocolate ice cream for his tea. What is your first action? Option A. Substitute Diet Cola for the ice cream. Option B. Hold the nourishment and report to the charge nurse. Option C. Ask the secretary to notify the kitchen of an error. Option D. Ask the other residents if they want it. The correct answer is option B. Hold the nourishment and report to the charge nurse. Explanation. Nursing assistants cannot make dietary substitutions. The nurse must verify the safety of the food provided. Question 115. When assisting a client using a bedside commode, it is important to do what? Option A. Leave the call light within reach. Option B. Place toilet tissue close by. Option C. Return to check on the client periodically. Option D. All of these are correct. The correct answer is option D. All of these are correct. Explanation. Safety and privacy must be balanced when a resident is using the commode. Question 116. Ensuring adequate circulation to tissues is a major factor in preventing skin breakdown. This can be accomplished by all of the following except what? Option A. Positioning the patient every 2 hours. Option B. Using mechanical aids. Option C. Giving back rubs. Option D. Performing range of motion exercises. The correct answer is option B, using mechanical aids. Explanation. Mechanical aids like lifts do not improve circulation, movement and pressure relief are required. Question 117. What is the usual purpose of cold applications? Option A, to speed the flow of blood to the area. Option B, to prevent heat exhaustion. Option C, to prevent or reduce swelling. Option D, to prevent the formation of scar tissue. The correct answer is option C, to prevent or reduce swelling. Explanation. Cold constricts blood vessels, which helps limit fluid buildup and inflammation after an injury. Question 118. The hot water bottle is an example of which type of treatment? Option A, local dry heat application. Option B, generalized dry heat application. Option C, local moist heat application. Option D, generalized moist heat application. The correct answer is option A, local dry heat application. Explanation. A hot water bottle provides heat to a specific area without moisture contacting the skin. Question 119. Clients receiving an enema are usually placed in which position? Option A, on the right side. Option B, on the left side. Option C, flat on the back. Option D, in a semi-sitting position. The correct answer is option B, on the left side. Explanation. The left side lying position allows the fluid to flow naturally into the colon based on human anatomy. Question 120. A female client's perineal area should be cleansed before which specimen is collected? Option A, 24-hour urine specimen. Option B, midstream clean catch urine specimen. Option C, pediatric routine urine specimen. Option D, routine urine specimen. The correct answer is option D, midstream clean catch urine specimen. Explanation. Cleaning the area ensures that the urine sample is not contaminated by external bacteria or skin cells. Question 121. What is the most common site for counting the pulse? Option A, the carotid artery. Option B, the femoral artery. Option C, the brachial artery. Option D, the radial artery. The correct answer is option D, the radial artery. Explanation. The radial pulse at the wrist is the most accessible and common site for routine vital signs. Question 122. When counting respirations, the nursing assistant should do what? Option A, wait until after the client has exercised. Option B, not tell the patient what you are going to do. Option C, count 5 respirations and then check your watch. Option D, have the client count while you take the pulse. The correct answer is option B, not tell the patient what you are going to do. Explanation. People often change their breathing patterns if they know they are being observed. Question 123. With catheterized patients, which of the following is not the nursing assistant's responsibility? Option A, inserting the catheter. Option B, preventing infection. Option C, checking to make sure it is draining properly. Option D, recording output. The correct answer is option A, inserting the catheter. Explanation. Catheter insertion is a sterile procedure that must be performed by a licensed nurse. Question 124. When giving information to the charge nurse for an incident report, you should do what? Option A, write in the client's chart that an incident occurred. Option B, keep the report in your personal file. Option C, state the facts clearly. Option D, give your opinions as to the cause. The correct answer is option C, state the facts clearly. Explanation. Accurate, objective reporting is necessary for the facility to investigate and prevent future incidents. Question 125. All long-term care nursing assistants must be competency evaluated and complete an educational course. These requirements are set by which act? Option A, the Omnibus Budget Reconciliation Act. Option B, the Occupational Safety and Health Administration. Option C, the Centers for Disease Control and Prevention. Option D, the Food and Drug Administration. The correct answer is option A, the Omnibus Budget Reconciliation Act. Explanation. The Omnibus Budget Reconciliation Act of 1987 established national standards for nursing assistant training. Question 126. When a resident is blind, it is important not to do which of the following? Option A. Leave the door completely open. Option B. Rearrange the furniture. Option C. Announce yourself before entering. Option D. Explain the location of food on the plate. The correct answer is option B. Rearrange the furniture. Explanation. Keeping furniture in a consistent place allows the blind resident to navigate their room safely. Question 127. When family members visit a client, the nursing assistant should do what? Option A. Ask them to stay in the day room. Option B. Tell them to stay only a short while. Option C. Expect them to help with care. Option D. Allow them privacy with the client. The correct answer is option D. Allow them privacy with the client. Explanation. Residents have the right to private visits with their loved ones. Question 128. A new resident asks you who will be there if they get sick during the night. You should say what? Option A. Don't worry, you are not going to get sick. Option B. Just yell and someone will hear you. Option C. Ask your roommate to ring the call bell. Option D. There are people here all night to help you. The correct answer is option D. There are people here all night to help you. Explanation. Providing honest reassurance helps reduce the anxiety of a new resident. Question 129. Which of the following is considered a client's right? Option A. Having curtains pulled during personal care. Option B. Having personal information kept confidential. Option C. Receiving and sending private mail. Option D. All of these are correct. The correct answer is option D. All of these are correct. Explanation. The Resident Bill of Rights protects privacy, confidentiality, and personal communication. Question 130. Mrs. Wilkes often cries while she is receiving her evening care. What should you do? Option A. Tell her to stop crying. Option B. Ignore her and continue with her care. Option C. Tell her jokes to make her laugh. Option D. Tell her it is all right to cry and you are there for her. The correct answer is option D. Tell her it is all right to cry and you are there for her. Explanation. Empathy and emotional support are key components of quality care for the elderly. Question 131. When providing denture care, the nursing assistant must do what? Option A. Wash them with hot water. Option B. Hold them firmly under cool running water. Option C. Place a towel in the sink. Option D. Hold them firmly and place a towel in the sink. The correct answer is option D. Hold them firmly and place a towel in the sink. Explanation. Padding the sink and using cool water protects the dentures from breaking or warping. Question 132. Sexuality in long-term care clients may include all of the following except which one? Option A. Needing private time with a partner. Option B. Caring about one's physical appearance. Option C. Engaging in public fondling. Option D. Desiring sexual interaction. The correct answer is option C. Engaging in public fondling. Explanation. While sexuality is a right, public displays are generally restricted to maintain a professional environment for all residents. Question 133. Mrs. Wilkes is scheduled for a partial bed bath. This means you must wash her what? Option A. Face, neck, ears, arms and hands. Option B. Face, underarms, hands and buttocks. Option C. Face, hands, underarms and legs. Option D. Face, hands, underarms, buttocks and genitals. The correct answer is option D. Face, hands, underarms, buttocks and genitals. Explanation. A partial bath focuses on the areas that require the most frequent cleaning for hygiene and odor control. Question 134. A goal for a resident is that she not swear at the staff. When she calls you by your name instead of swearing, what is your appropriate action? Option A. Smile and give the appropriate reward. Option B. Continue whatever task is being done. Option C. Tease the resident about not swearing. Option D. Tell all of the staff that she did not swear. The correct answer is option A. Smile and give the appropriate reward. Explanation. Positive reinforcement encourages the resident to continue the desired behavior. Question 135. An agitated resident must be turned every 2 hours all night. What is the first action when waking her? Option A. Turn on the light. Option B. Speak quietly and calmly. Option C. Touch her shoulder. Option D. Shout her name. The correct answer is option B. Speak quietly and calmly. Explanation. Approaching an agitated resident calmly helps prevent a startled response or further escalation. Question 136. If a client objects to a certain food for religious or cultural reasons, the appropriate action would be to do what? Option A. Tell him to wait for the next meal. Option B. Offer to substitute something different for him. Option C. Call the dietitian the next day. Option D. Tell him he needs to eat what is on his tray. The correct answer is option B. Offer to substitute something different for him. Explanation. Respecting dietary restrictions is part of providing person-centered care. Question 137. A client's religion forbids eating pork and bacon is being served. The most appropriate response is to do what? Option A. Encourage the client to eat it for the protein. Option B. Tell the client it is alright because the doctor ordered it. Option C. Call the kitchen for a tray without bacon. Option D. Tell the client that restrictions are not as important as health. The correct answer is option C. Call the kitchen for a tray without bacon. Explanation. Healthcare workers must facilitate a resident's religious practices whenever possible. Question 138. Which type of communication can often be most powerful? Option A. Written communication. Option B. Verbal communication. Option C. Silent or non-verbal communication. Option D. Tactile or touch communication. The correct answer is option C. Silent or non-verbal communication. Explanation. Body language and facial expressions often convey more meaning than spoken words. Question 139. You tell a resident that if they do not let you wash them, they will not get lunch. This is an example of what? Option A. Discipline. Option B. Verbal abuse. Option C. Mental abuse. Option D. Physical abuse. The correct answer is option B. Verbal abuse. Explanation. Threatening a resident to force compliance is considered verbal and emotional abuse. Question 140. When getting ready to make a bed, the nursing assistant should place the clean linens where? Option A. On the floor next to the bed. Option B. On the resident's overbed table. Option C. On a chair or table beside the bed. Option D. On top of the dirty linens. The correct answer is option C. On the chair or table beside the bed. Explanation. Clean linens should only be placed on clean surfaces to prevent contamination. Question 141. What is the only purpose for using a physical restraint? Option A. To keep a resident from wandering. Option B. To ensure the safety of the client or others. Option C. To make it easier for staff to provide care. Option D. To punish a resident for bad behavior. The correct answer is option B. To ensure the safety of the client or others. Explanation. Restraints are safety intervention of last resort and require a physician's order. Question 142. Articles contaminated with blood or body fluids should be disposed of in which container? Option A. The regular trash can. Option B. The laundry hamper. Option C. The biohazard container. Option D. The recycling bin. The correct answer is option C. The biohazard container. Explanation. Specialized containers are required for medical waste to prevent the spread of pathogens. Question 143. To avoid pulling the indwelling urethral catheter when turning a client, the tubing should be secured to what? Option A. The bed rail. Option B. The resident's upper thigh. Option C. The resident's abdomen. Option D. The foot of the bed. The correct answer is option B. The resident's upper thigh. Explanation. Securing the tube to the leg prevents accidental pulling and trauma to the urethra. Question 144. When collecting a 24-hour urine sample, the nursing assistant should request that the client do what? Option A, keep the first voided urine. Option B, discard the first voided urine. Option C, only collect urine during the day. Option D, stop drinking fluids for the day. The correct answer is option B. Discard the first voided urine. Explanation. The collection period begins after the first void is discarded, ensuring exactly 24 hours of production is measured. Question 145. When ambulating a client, the nursing assistant should be sure the client is wearing what? Option A, no shoes at all. Option B, socks only. Option C, non-skid footwear. Option D, high-heeled shoes. The correct answer is option C, non-skid footwear. Explanation. Sturdy, non-slip shoes or slippers are vital for preventing falls during walking. Question 146. Which item is the best personal protective equipment for handling infectious waste that could splash? Option A, a pair of gloves. Option B, a face shield. Option C, a cloth mask. Option D, a plastic apron. The correct answer is option B, a face shield. Explanation. A face shield protects the eyes, nose and mouth from potentially infectious splashes. Question 147. What is an appropriate response if a client expresses anger during care? Option A, tell them to be quiet and cooperate. Option B, say, you seem upset, would you like to talk about it? Option C, leave the room immediately. Option D, tell them they are being ungrateful. The correct answer is option B. Say, you seem upset, would you like to talk about it? Explanation. Acknowledging the resident's feelings helps to escalate the situation and builds trust. Question 148. You forgot needed supplies after raising the bed to working height. What should you do next? Option A, leave the bed up and run to get the supplies. Option B, ask the resident to watch the door while you are gone. Option C, lower the bed and place the call light within reach. Option D, ask another resident to find a nurse. The correct answer is option C, lower the bed and place the call light within reach. Explanation. A resident must never be left alone in a high bed because of the severe risk of falling. Question 149. A client requests that you call their spiritual advisor. What should the nursing assistant do? Option A, tell the client you will inform the nurse of the request. Option B, tell the client to wait until their family visits. Option C, give the client the phone book to find the number. Option D, explain that advisors are not allowed in the facility. The correct answer is option A. Tell the client you will inform the nurse of the request. Explanation. The nurse is responsible for coordinating with spiritual leaders as part of the resident's care plan. Question 150. A client wakes up and asks for something to eat at night. What should the assistant do? Option A, tell them the kitchen is closed. Option B, check the client's diet before offering nourishment. Option C, give them whatever they want from the staff fridge. Option D, tell them they have to wait until breakfast. The correct answer is option B. Check the client's diet before offering nourishment. Explanation. The assistant must ensure the snack is safe according to the resident's prescribed diet and swallowing status. Question 151. What should a nursing assistant do first before beginning to bathe a client? Option A, shampoo the hair. Option B, tell the client what you are going to do. Option C, undress the client completely. Option D, turn on the television. The correct answer is option B. Tell the client what you are going to do. Explanation. Communicating before starting care is essential for informed consent and resident comfort. Question 152. When making a bed that is occupied by a client, what should the assistant do? Option A, keep the head of the bed as high as possible. Option B, make a toe pleat in the top covers. Option C, use only one person to move the resident. Option D, avoid talking to the resident. The correct answer is option B. Make a toe pleat in the top covers. Explanation. A toe pleat prevents the covers from being too tight and causing pressure on the resident's feet. Question 153. Frequent turning and repositioning of the client helps to prevent which condition? Option A, dementia. Option B, arthritis. Option C, pressure injuries. Option D, heart disease. The correct answer is option C, pressure injuries. Explanation. Relieving pressure on bony prominences is a primary way to maintain skin integrity. Question 154. When applying elastic stockings to a client, it is best to position the client how? Option A, sitting in a chair. Option B, standing at the bedside. Option C, lying down in bed. Option D, walking in the hallway. The correct answer is option C, lying down in bed. Explanation. Stockings should be applied before the resident gets out of bed and their legs begin to swell. Question 155. You hear other assistants discussing how rude a client was in the dining room. What should you do? Option A, join the conversation and share your own stories. Option B, suggest that this is not the place to discuss the client. Option C, record the conversation to show the nurse. Option D, ignore them and walk away. The correct answer is option B, suggest that this is not the place to discuss the client. Explanation. Discussing residents in public areas is a violation of HIPAA and professional ethics. Question 156. The client signaling device should always be placed where? Option A, on the overbed table. Option B, at the foot of the bed. Option C, within the client's reach. Option D, on the floor. The correct answer is option C, within the client's reach. Explanation. The call light is the resident's safety lifeline and must be accessible at all times. Question 157. When helping a client recovering from a stroke to walk, where should the assistant be? Option A, on the client's strong side. Option B, on the client's weak side. Option C, in front of the client. Option D, behind the client holding their waist. The correct answer is option B, on the client's weak side. Explanation. Supporting the weak side provides stability and prevents falls if the resident's leg buckles. Question 158. A confused client begins to cry and scream for their parent. What should you do next? Option A, tell them their parent is dead. Option B, give them a sedative. Option C, talk to them in a calm voice about familiar things. Option D, ignore the behavior until they stop. The correct answer is option C, talk to them in a calm voice about familiar things. Explanation. Calm, supportive communication can help redirect and soothe a distressed resident. Question 159. Which action best shows respect to the spiritual needs of a client? Option A, forcing them to attend the facility's church service. Option B, assisting them to read their religious materials. Option C, telling them their beliefs are wrong. Option D, ignoring their requests for chaplain. The correct answer is option B, assisting them to read their religious materials. Explanation. Supporting a resident's ability to practice their own faith is a requirement of quality care. Question 160. A client calls you by the name of their child who died years ago. What is your best response? Option A, correct them and tell them you are not their child. Option B, ask the client about their favorite memories of their child. Option C, ignore the comment and continue care. Option D, tell the client they are being silly. The correct answer is option B, ask the client about their favorite memories of their child. Explanation. Using validation therapy allows the resident to express their feelings without being distressed by a correction. Question 161. When providing care for a client receiving oxygen therapy, the assistant should do what? Option A, turn off the oxygen during a bath. Option B, check the ears for pressure points from the tubing. Option C, encourage the resident to smoke only in their room. Option D, clean the tubing with bleach every day. The correct answer is option B, check the ears for pressure points from the tubing. Explanation. The plastic tubing can cause skin breakdown behind the ears if it is too tight or remains in one place. Question 162. A client falls and suffers a deep cut on the forehead. What do you do next? Option A, run to the nurse's station for help. Option B, stay with the client and call for help. Option C, apply a tight tourniquet around the neck. Option D, Try to lift the client back into bed. The correct answer is option B. Stay with the client and call for help. Explanation. Never leave an injured resident alone. Use a call system or yell for help while staying by their side. Question 163. A client has been depressed since being admitted. What is the best thing for the assistant to do? Option A. Tell them to cheer up. Option B. Introduce the client to other clients and staff. Option C. Leave them alone until they feel better. Option D. Tell them you are too busy to talk. The correct answer is option B. Introduce a client to other clients and staff. Explanation. Helping a resident socialize can reduce feelings of isolation and improve their transition to the facility. Question 164. A confused client asks what day it is. What should the nursing assistant do? Option A. Tell them to look it up themselves. Option B. Point to the date on a calendar and say the date. Option C. Tell them the wrong date to see if they notice. Option D. Ignore the question and change the subject. The correct answer is option B. Point to the date on a calendar and say the date. Explanation. Using visual aids like calendars helps reorient a confused resident to their surroundings. Question 165. Which of the following is most important for the prevention of skin breakdown? Option A. Using a lot of powder on the skin. Option B. Repositioning the client every 2 hours. Option C. Keeping the room very hot. Option D. Giving the resident more pills. The correct answer is option B. Repositioning the client every 2 hours. Explanation. Turning the resident regularly ensures that no single area of the body is under constant pressure. Question 166. When caring for a client who is dying, the nursing assistant should do what? Option A. Avoid talking to the client. Option B. Pay special attention to fluid intake and mouth care. Option C. Keep the room very bright. Option D. Perform heavy exercises with a client. The correct answer is option B. Pay special attention to fluid intake and mouth care. Explanation. Comfort care for the dying focuses on keeping mucous membranes moist and the body hydrated. Question 167. To best communicate with a client who has total hearing loss, what should you do? Option A. Shout as loudly as possible. Option B. Write out the information. Option C. Avoid talking to them at all. Option D. Speak to them from another room. The correct answer is option B. Write out the information. Explanation. Written communication ensures the resident receives information accurately when they cannot hear. Question 168. When a weak resident is positioned in a chair, where should the signaling device be? Option A. On the nurse's station. Option B. On the resident's bed. Option C. Within the client's reach. Option D. In the resident's pocket. The correct answer is option C. Within the client's reach. Explanation. Safety requires that the resident can call for help regardless of where they are sitting. Question 169. How can a nursing assistant promote independence when bedding a client who had a stroke? Option A. Do everything for the client to save time. Option B. Encourage the client to do as much as possible and assist as needed. Option C. Tell the client they are too slow and take over. Option D. Make the client do everything without any help. The correct answer is option B. Encourage the client to do as much as possible and assist as needed. Explanation. Encouraging self-care helps the resident regain function and maintain self-esteem. Question 170. Which method is the correct way to remove a dirty isolation gown? Option A. Pull it off over your head. Option B. Roll the gown dirty side in and away from the body. Option C. Shake the gown to get the germs off. Option D. Drop it on the floor for housekeeping. The correct answer is option B. Roll the gown dirty side in and away from the body. Explanation. Rolling the gown inward traps pathogens inside and prevents them from touching your uniform. Question 171. Which healthcare team member assists the client with performing activities of daily living? Option A. The physical therapist. Option B. The occupational therapist. Option C. The respiratory therapist. Option D. The pharmacist. The correct answer is option D, the occupational therapist. Explanation. Occupational therapists focus on helping residents adapt to their environment and perform daily tasks. Question 172. What does the term ambulate with assistance mean? Option A. The client can walk alone. Option B. The client can walk with the nursing assistant providing help. Option C. The client must stay in bed. Option D. The client needs a mechanical lift. The correct answer is option B. The client can walk with the nursing assistant providing help. Explanation. Assisted ambulation means the resident needs physical support or supervision from a staff member. Question 173. When transferring a client, most of the client's weight should be supported by what? Option A. The nursing assistant's back. Option B. The nursing assistant's legs. Option C. The client's arms. Option D. The nursing assistant's shoulders. The correct answer is option B, the nursing assistant's legs. Explanation. Using the large muscles in the legs prevents back strain and ensures a stable transfer. Question 174. When changing a soiled dressing, when should the nursing assistant wash their hands? Option A. Only at the end of the procedure. Option B. Before, during, and after the procedure. Option C. Only before starting. Option D. Hand washing is not necessary if you wear gloves. The correct answer is option B, before, during, and after the procedure. Explanation. Multiple hand washes prevent the cross-contamination of clean supplies and the environment. Question 175. A nursing assistant must wear gloves when performing which task? Option A. Helping a resident walk. Option B. Providing mouth care. Option C. Brushing a resident's hair. Option D. Feeding a resident a sandwich. The correct answer is option B, providing mouth care. Explanation. Mouth care involves contact with mucous membranes and saliva, which requires standard precautions. Question 176. When assisting a client with right-sided weakness to transfer from a wheelchair, you should support which side? Option A. The left side. Option B. The right side. Option C. Both sides equally. Option D. No support is needed. The correct answer is option B, the right side. Explanation. The weak side is the most likely to buckle or fail, so it requires the most support from the assistant. Question 177. The nursing assistant can help prevent pressure injuries by doing what? Option A. Keeping linens clean, dry and wrinkle-free. Option B. Using strong soaps on the skin. Option C. Turning the resident once every 8 hours. Option D. Limiting the resident's fluid intake. The correct answer is option A, keeping linens clean, dry and wrinkle-free. Explanation. Moisture and friction from wrinkled or dirty sheets are major contributors to skin breakdown. Question 178. If you discover a small fire in a client's room, what should you do first? Option A. Run for a fire extinguisher. Option B. Remove the client from any danger. Option C. Close the door and walk away. Option D. Call the fire department on your cell phone. The correct answer is option B. Remove the client from any danger. Explanation. Resident safety is the absolute first priority in any emergency situation. Question 179. When a client has memory loss or confusion, the nursing assistant should do what? Option A. Give them many choices at once. Option B. Give the client simple, step-by-step instructions. Option C. Speak to them in a very fast voice. Option D. Avoid talking to the client. The correct answer is option B. Give the client simple, step-by-step instructions. Explanation. Breaking tasks into small steps helps a confused resident follow directions without becoming overwhelmed. Question 180. What does the medical abbreviation ADL mean? Option A. Additional daily lessons. Option B. Activities of daily living. Option C. Advanced dietary limits. Option D. Average daily loss. The correct answer is option B. Activities of daily living. Explanation. Activities of daily living include basic self-care tasks like eating, bathing, and dressing. Question 181. Which action should you take to communicate with a client who has a hearing loss? Option A. Face the client when speaking. Option B. Speak into the client's ear from behind. Option C. Shout at the client. Option D. Walk away while you are talking. The correct answer is option A. Face the client when speaking. Explanation. Facing the resident allows them to see your facial expressions and read your lips, which aids communication. Question 182. What is the first area of a client's body that you should wash when providing a bed bath? Option A. The feet. Option B. The perineal area. Option C. The face. Option D. The back. The correct answer is option C. The face. Explanation. Washing from the cleanest area to the dirtiest prevents the spread of bacteria. Question 183. When a nurse provides you with confidential information about a client, what should you do? Option A. Tell your friends about it. Option B. Keep the information private. Option C. Post it on social media. Option D. Tell the resident's roommate. The correct answer is option B. Keep the information private. Explanation. Healthcare workers have a legal and ethical duty to maintain resident confidentiality. Question 184. Before entering a client's room, what should the nursing assistant do first? Option A. Just walk in. Option B. Knock on the door. Option C. Yell hello from the hallway. Option D. Wait for the resident to call you. The correct answer is option B. Knock on the door. Explanation. Knocking shows respect for the resident's home and privacy. Question 185. Mouth care for an unconscious client must be done how often? Option A. Once per day. Option B. Every 2 hours. Option C. Every 12 hours. Option D. Only when they wake up. The correct answer is option B. Every 2 hours. Explanation. Frequent care is needed to prevent infection and keep the mouth tissues from cracking. Question 186. Where should the nursing assistant place a client's soiled bedsheets? Option A. On the floor. Option B. In the soiled linen container. Option C. In the regular trash. Option D. On a clean chair. The correct answer is option B. In the soiled linen container. Explanation. Proper disposal of soiled linen is essential for infection control. Question 187. Before taking the oral temperature of a client who just had a cold drink, you should wait how long? Option A. 5 minutes. Option B. 20 minutes. Option C. 1 hour. Option D. No wait is needed. The correct answer is option B. 20 minutes. Explanation. Waiting 20 minutes ensures the mouth temperature has stabilized for an accurate reading. Question 188. To prevent dehydration, the nursing assistant should do what? Option A. Offer fluids frequently while the client is awake. Option B. Only give water at mealtimes. Option C. Limit the resident to 1 glass of water a day. Option D. Make the resident drink a gallon of water at once. The correct answer is option A. Offer fluids frequently while the client is awake. Explanation. Small, frequent offerings of fluids are the most effective way to ensure adequate hydration. Question 189. When preparing a meal tray, what is the most important action to take? Option A. Check that the tray looks pretty. Option B. Check that the client's name is on the tray card. Option C. Taste the food to make sure it is good. Option D. Add extra salt to all the food. The correct answer is option B. Check that the client's name is on the tray card. Explanation. Giving the wrong diet to a resident can lead to serious medical complications or choking. Question 190. Which equipment should you have available when caring for a client's beard? Option A. Towel, gloves, razor, and shaving cream. Option B. A bowl of hot soup. Option C. A pair of scissors and a hair dryer. Option D. Nail clippers and lotion. The correct answer is option A. Towel, gloves, razor, and shaving cream. Explanation. Standard shaving supplies and gloves are required for safe and hygienic beard care. Question 191. To find out what type of diet a client should receive, where should you check? Option A, in the client's care plan. Option B, ask the resident's roommate. Option C, guess based on what they like. Option D, check the newspaper. The correct answer is option A, in the client's care plan. Explanation. The care plan is the official source of information for all resident needs and medical orders. Question 192. What should you do when a client with Alzheimer's disease seems depressed and quiet? Option A, ignore them. Option B, observe the client for non-verbal cues. Option C, tell them to cheer up. Option D, leave the room and lock the door. The correct answer is option B. Observe the client for non-verbal cues. Explanation. Residents with dementia may not be able to express their pain or sadness in words. Question 193. Which of these actions best demonstrates active listening skills? Option A, looking at your watch while the resident talks. Option B, responding when appropriate. Option C, interrupting the resident to tell your own story. Option D, walking out of the room. The correct answer is option B, responding when appropriate. Explanation. Active listening involves giving the speaker your full attention and providing feedback. Question 194. The nursing assistant should understand that a back massage does what? Option A, causes the resident to become angry. Option B, promotes circulation. Option C, is only for the staff. Option D, should be done with cold water. The correct answer is option B, promotes circulation. Explanation. Massages help relax the resident and stimulate blood flow to the skin and muscles. Question 195. When assisting with dressing a client with left-sided weakness, what part of a sweater is put on first? Option A, the right sleeve. Option B, the left sleeve. Option C, both sleeves at once. Option D, the collar. The correct answer is option B, the left sleeve. Explanation. Always dress the weak side first to make the process easier for the resident. Question 196. A client with arthritis has trouble cutting food. What should you do to encourage independence? Option A, feed the client yourself. Option B, assist in cutting the food and encourage use of special utensils. Option C, tell the client they are not trying hard enough. Option D, take the food away. The correct answer is option B, assist in cutting the food and encourage use of special utensils. Explanation. Adaptive equipment allows residents with physical limitations to maintain their independence. Question 197. How many legs does a quad cane have? Option A, 1. Option B, 2. Option C, 3. Option D, 4. The correct answer is option D, 4. Explanation. A quad cane has a 4-point base that provides more stability than a standard cane. Question 198. Once a client has been pronounced dead, the responsibility of the nursing assistant is to do what? Option A, call the funeral home. Option B, make sure the body is clean. Option C, notify the distant relatives. Option D, perform an autopsy. The correct answer is option B, make sure the body is clean. Explanation. Post-mortem care involves cleaning the body and preparing it for viewing by the family. Question 199. A client drinks 240 milliliters of soup, 120 milliliters of coffee and 90 milliliters of juice. What is the total liquid intake? Option A, 400 milliliters. Option B, 450 milliliters. Option C, 500 milliliters. Option D, 550 milliliters. The correct answer is option B, 450 milliliters. Explanation. Adding 240, 120 and 90 equals 450 milliliters. Question 200. What is the term for a device used to take the place of a missing body part? Option A, a bandage. Option B, an orthotic. Option C, a cast. Option D, a prosthesis. The correct answer is option D, a prosthesis. Explanation. Prosthetic devices include artificial limbs, eyes and teeth. Question 201. It is appropriate for a nursing assistant to share information about a client's status with whom? Option A, the resident's best friend. Option B, the local news. Option C, the staff on the next shift. Option D, the client's neighbor. The correct answer is option C, the staff on the next shift. Explanation. Handover communication ensures continuity of care for the resident. Question 202. A nursing assistant is caring for an agitated client. What should the assistant do? Option A, shout at the client to be quiet. Option B, talk in a slow, calm, reassuring manner. Option C, restrain the client immediately. Option D, leave the client alone in the hallway. The correct answer is option B, talk in a slow, calm, reassuring manner. Explanation. Calm communication is the most effective way to de-escalate agitation in a resident. Question 203. What is the purpose for padding side rails on a client's bed? Option A, to make the bed look better. Option B, to keep the resident warm. Option C, to protect the client from injury. Option D, to store the resident's remote control. The correct answer is option C, to protect the client from injury. Explanation. Padding prevents the resident from hitting their limbs against the hard metal rails. Question 204. Exercises that move each muscle and joint are called what? Option A, weightlifting. Option B, range of motion. Option C, running. Option D, yoga. The correct answer is option B, range of motion. Explanation. Range of motion exercises help prevent contractures and maintain joint health. Question 205. How can you best help a client who is not accepting a loss? Option A, tell them to get over it. Option B, encourage the client to talk. Option C, ignore the client's feelings. Option D, tell them you are too busy to listen. The correct answer is option B, encourage the client to talk. Explanation. Providing a supportive environment allows the resident to process their grief. Question 206. The Heimlich maneuver or abdominal thrusts are used for a client who has what? Option A, a broken leg. Option B, a blocked airway. Option C, a headache. Option D, a fever. The correct answer is option B, a blocked airway. Explanation. This emergency procedure is used to dislodge an object from a person's windpipe. Question 207. To avoid pulling the catheter when turning a male client, the tube must be taped to which part of the body? Option A, the abdomen. Option B, the upper thigh. Option C, the foot. Option D, the bed rail. The correct answer is option B, the upper thigh. Explanation. Securing the tube to the leg prevents painful pulling on the bladder and urethra. Question 208. The role of the ombudsman is to do what? Option A, perform surgeries. Option B, work with the nursing home to protect client rights. Option C, cook meals for the residents. Option D, clean the facility floors. The correct answer is option B, work with the nursing home to protect client rights. Explanation. The ombudsman is an independent advocate for residents in long-term care. Question 209. A nursing assistant who is active in her church is assigned to a client with no religious group. What should she do? Option A, force the resident to join her church. Option B, respect the client's beliefs and avoid starting religious discussions. Option C, tell the resident they are going to hell. Option D, avoid the resident entirely. The correct answer is option B, respect the client's beliefs and avoid starting religious discussions. Explanation. Professionalism requires respecting the resident's personal beliefs without judgment. Question 210. What should you do when a client's mail is delivered? Option A, open and read it first. Option B, give the client the unopened mail and offer help as needed. Option C, throw the mail away. Option D, leave it at the nurse's station. The correct answer is option B, give the client the unopened mail and offer help as needed. Explanation. Residents have a legal right to private, unopened mail. Question 211. Which of the following is a correct measurement of urinary output? Option A, 300 pounds. Option B, 300 degrees. Option C, 300 cubic centimeters. Option D, 300 inches. The correct answer is option C, 300 cubic centimeters. Explanation. Cubic centimeters are equivalent to milliliters and are used to measure fluid volume. Question 212. A client offers you a $20 bill as a thank you. What should you do? Option A, take the money and buy lunch. Option B, politely refuse the money. Option C, tell the resident it is not enough. Option D, report the resident to the police. The correct answer is option B, politely refuse the money. Explanation. Healthcare workers are not permitted to accept tips or gifts from residents. Question 213. If a client is sitting in their room masturbating, what should the nursing assistant do? Option A, shout at them to stop. Option B, leave the client alone and provide privacy. Option C, call their family and tell them. Option D, report them to the police. The correct answer is option B. Leave the client alone and provide privacy. Explanation. Residents have a right to sexual expression in their own private space. Question 214. To convert 4 ounces of juice to milliliters, what should you multiply 4 by? Option A, 10. Option B, 20. Option C, 30. Option D, 40. The correct answer is option C, 30. Explanation. Multiplying by 30 is the standard conversion for ounces to milliliters. Question 215. What is the normal aging process best defined as? Option A, a time when you become much smarter. Option B, a time when normal body functions and senses decline. Option C, a time when you no longer need to eat. Option D, a time when you become a child again. The correct answer is option B, the time when normal body functions and senses decline. Explanation. Aging involves a gradual decrease in the physiological reserve of the body's systems. Question 216. What is the process of restoring a disabled client to the highest level of functioning possible? Option A, retirement. Option B, rehabilitation. Option C, recession. Option D, reduction. The correct answer is option B, rehabilitation. Explanation. Rehabilitation programs involve many different types of therapy to help a resident recover. Question 217. Clean bed linen placed in a client's room but not used should be handled how? Option A, put back on the clean linen cart. Option B, put in the dirty linen container. Option C, saved for the next week. Option D, given to another resident. The correct answer is option B, put in the dirty linen container. Explanation. Once linen enters a resident's room, it is considered contaminated and cannot be used for anyone else. Question 218. Proper use of the waist restraint requires that the nursing assistant do what? Option A, tie it as tight as possible. Option B, watch for skin irritation. Option C, leave it on for 24 hours. Option D, tie it to the side rails. The correct answer is option B, watch for skin irritation. Explanation. Frequent monitoring is required to prevent skin damage or strangulation from restraints. Question 219. How many tips does a quad cane base have? Option A, 1. Option B, 2. Option C, 3. Option D, 4. The correct answer is option D, 4. Explanation. The 4 tips provide a wider base of support and more stability for the resident. Question 220. A safety device used to assist a dependent client from a bed to a chair is called what? Option A, a life jacket. Option B, a transfer or gait belt. Option C, a pair of handcuffs. Option D, a heavy rope. The correct answer is option B, a transfer or gait belt. Explanation. The belt gives the assistant a secure grip to help the resident during the transfer. Question 221. If you need to wear a gun for a client in isolation, when must you take it off? Option A, at the nurse's station. Option B, before leaving the client's room. Option C, in the cafeteria. Option D, when you get home. The correct answer is option B, before leaving the client's room. Explanation. Taking the gown off in the room prevents the spread of pathogens to the rest of the facility. Question 222. What is a beginning sign of a pressure sore? Option A, a deep hole in the skin. Option B, discoloration of the skin. Option C, a large bruise. Option D, clear skin. The correct answer is option B, discoloration of the skin. Explanation. Redness or change in color that does not go away is the first sign of tissue damage. Question 223. A sudden illness from which a person is expected to recover is called what? Option A, a chronic illness. Option B, an acute illness. Option C, a terminal illness. Option D, a permanent illness. The correct answer is option B, an acute illness. Explanation. Acute illnesses have a rapid onset and a relatively short duration. Question 224. An ongoing illness that is slow or gradual in onset and has no known cure is called what? Option A, an acute illness. Option B, a terminal illness. Option C, a chronic illness. Option D, a short-term illness. The correct answer is option C, a chronic illness. Explanation. Chronic illnesses like heart disease or diabetes require long-term management. Question 225. Which member of the nursing team is responsible for the entire nursing staff? Option A, the certified nursing assistant. Option B, the licensed practical nurse. Option C, the director of nursing. Option D, the medical doctor. The correct answer is option C, the director of nursing. Explanation. The director of nursing is the highest-ranking administrative nurse in the facility. Question 226. What is the term for an unexpected event that causes harm to a resident? Option A, an incident. Option B, a routine. Option C, an assessment. Option D, a policy. The correct answer is option A, an incident. Explanation. Incidents must be documented and investigated to improve facility safety. Question 227. Which of the following describes a resident who is aware of self, place, and time? Option A, alert and oriented times 0. Option B, alert and oriented times 1. Option C, alert and oriented times 2. Option D, alert and oriented times 3. The correct answer is option D, alert and oriented times 3. Explanation. Orientation to person, place, and time is a standard measure of cognitive function. Question 228. What is the term for a federal health insurance program for people aged 65 or older? Option A, Medicaid. Option B, Medicare. Option C, HMO. Option D, PPO. The correct answer is option B, Medicare. Explanation. Medicare is the primary insurance provider for the elderly in the United States. Question 229. A person who helps residents voice grievances and protects their rights is called what? Option A, a doctor. Option B, a lawyer. Option C, an ombudsman. Option D, a physical therapist. The correct answer is option C, an ombudsman. Explanation. The Ombudsman acts as an independent advocate for individuals in long-term care. Question 230. Negligence by a professional person, such as a doctor or nurse, is called what? Option A, malpractice. Option B, slander. Option C, libel. Option D, battery. The correct answer is option A, malpractice. Explanation. Malpractice is a specific type of negligence related to professional standards of care. Question 231. Making false statements orally that damage a person's reputation is called what? Option A, libel. Option B, slander. Option C, assault. Option D, neglect. The correct answer is option B, slander. Explanation. Slander is the verbal form of defamation of character. Question 232. Unlawful restraint or restriction of a person's freedom of movement is called what? Option A, battery. Option B, assault. Option C, false imprisonment. Option D, fraud. The correct answer is option C, false imprisonment. Explanation: using restraints without proper authorization or medical need is a form of false imprisonment. Question 233. Touching a person's body without his or her consent is called what? Option A, assault. Option B, battery. Option C, neglect. Option D, ethics. The correct answer is option B, battery. Explanation: battery involves physical contact that is non-consensual or harmful. Question 234. Considering the whole person, including physical, social, psychological, and spiritual needs, is called what? Option A, holism. Option B, apathy. Option C, bariatrics. Option D, homeostasis. The correct answer is option A, holism. Explanation: holistic care addresses all aspects of a person's well-being, not just their physical illness. Question 235. A person who is unable to respond to stimuli is described as what? Option A, alert. Option B, confused. Option C, comatose. Option D, paranoid. The correct answer is option C, comatose. Explanation: a coma is a state of deep unconsciousness where the person cannot be awakened. Question 236. The characteristics of a group of people, such as language, values, and habits, is called what? Option A, ethics. Option B, holism. Option C, culture. Option D, religion. The correct answer is option C, culture. Explanation: culture influences how a person views health, illness, and healthcare providers. Question 237. In Maslow's hierarchy of needs, which needs must be met first? Option A, self-esteem. Option B, love and belonging. Option C, safety and security. Option D, physical or physiological needs. The correct answer is option D, physical or physiological needs. Explanation: basic needs like air, water, and food are the foundation of human survival. Question 238. Restating the person's message in your own words to ensure understanding is called what? Option A, clarifying. Option B, focusing. Option C, paraphrasing. Option D, open-ended questioning. The correct answer is option C, paraphrasing. Explanation: paraphrasing helps verify that the nursing assistant has interpreted the resident correctly. Question 239. The treatment of obesity is called what? Option A, pediatrics. Option B, geriatrics. Option C, bariatrics. Option D, obstetrics. The correct answer is option C, bariatrics. Explanation: bariatric care often involves specialized equipment for residents with high body weights. Question 240. What is the largest organ in the human body? Option A, the heart. Option B, the brain. Option C, the skin. Option D, the liver. The correct answer is option C, the skin. Explanation: the skin provides protection, temperature regulation, and sensory input for the entire body. Question 241. How many bones are in the human body? Option A, 100. Option B, 206. Option C, 350. Option D, 500. The correct answer is option B, 206. Explanation: the skeletal system provides the framework and support for all other body systems. Question 242. What are the two upper chambers of the heart called? Option A, the right and left ventricles. Option B, the right and left atria. Option C, the arteries and veins. Option D, the valves. The correct answer is option B, the right and left atria. Explanation: the atria receive blood returning to the heart from the lungs and the rest of the body. Question 243. Which blood vessels carry blood away from the heart to the rest of the body? Option A, veins. Option B, capillaries. Option C, arteries. Option D, venules. The correct answer is option C, arteries. Explanation: arteries have thick muscular walls to handle the high pressure of blood being pumped by the heart. Question 244. The brain and the spinal cord make up which system? Option A, the peripheral nervous system. Option B, the central nervous system. Option C, the autonomic nervous system. Option D, the skeletal system. The correct answer is option B, the central nervous system. Explanation. The central nervous system is the primary control center for the entire body. Question 245. Which system is responsible for the fight or flight response? Option A, the parasympathetic nervous system. Option B, the sympathetic nervous system. Option C, the digestive system. Option D, the integumentary system. The correct answer is option B, the sympathetic nervous system. Explanation. The sympathetic nervous system prepares the body to react to stress or danger. Question 246. What should you do if a resident starts to fall while you are walking with them? Option A, try to catch them and hold them up. Option B, run to get a chair. Option C, ease the resident to the floor. Option D, scream for help and let go. The correct answer is option C, ease the resident to the floor. Explanation. Easing the resident down prevents a hard impact and protects the assistant from back injury. Question 247. In the event of a fire, what does the letter R in the acronym RACE stand for? Option A, run away. Option B, ring the bell. Option C, rescue. Option D, relocate. The correct answer is option C, rescue. Explanation. The priority is to rescue any residents in immediate danger from the fire. Question 248. What is the first thing you should do when finding a conscious client lying on the bathroom floor? Option A, help them up immediately. Option B, call for assistance from the nurse in charge. Option C, give them a drink of water. Option D, put a blanket over them and walk away. The correct answer is option B, call for assistance from the nurse in charge. Explanation. The resident should not be moved until a nurse assesses them for internal injuries or fractures. Question 249. To be sure that a client's weight is measured accurately, when should they be weighed? Option A, at the same time of day. Option B, whenever the assistant has time. Option C, right after they eat a big meal. Option D, with their heavy winter coat on. The correct answer is option A, at the same time of day. Explanation. Weighing at the same time and in similar clothing ensures that weight trends are accurate. Question 250. What is the term for the stiffening of skeletal muscles that occurs after death? Option A, rigor mortis. Option B, homeostasis. Option C, peristalsis. Option D, atrophy. The correct answer is option A, rigor mortis. Explanation. Rigor mortis begins a few hours after death and is an important consideration in post-mortem care. Question 251. Inside the lungs, where does the actual exchange of oxygen and carbon dioxide take place? Option A, the trachea. Option B, the bronchi. Option C, the alveoli. Option D, the pleura. The correct answer is option C, the alveoli. Explanation. Alveoli are tiny air sacs with thin walls that allow gases to pass into the bloodstream. Question 252. What is the most common mental health disorder among the elderly population? Option A, schizophrenia. Option B, bipolar disorder. Option C, depression. Option D, paranoia. The correct answer is option C, depression. Explanation. Depression in the elderly is often underdiagnosed but is highly treatable with proper care. Question 253. Which of the following is a symptom of low blood sugar, also known as hypoglycemia? Option A, extreme thirst. Option B, sweet smell in breath. Option C, shakiness or trembling. Option D, frequent urination. The correct answer is option C, shakiness or trembling. Explanation. Hypoglycemia requires immediate treatment with a fast-acting source of sugar. Question 254. A prosthesis is defined as which of the following? Option A, a type of medication. Option B, an artificial limb or body part. Option C, a special type of diet. Option D, a medical insurance plan. The correct answer is option B, an artificial limb or body part. Explanation. Prosthetics help residents regain function after the loss of a natural body part. Question 255. The term nothing by mouth stands for which medical instruction? Option A, new patients only. Option B, nothing by mouth. Option C, normal pulse only. Option D, nighttime positioning only. The correct answer is option B, nothing by mouth. Explanation. Nothing by mouth is a common order before surgery or when a resident is suffering from severe nausea.